Welcome to Golbalsportscare. My name is Dr. Markus Laupheimer. I'm a sports physician in London and Switzerland, and I'm going to have a chat today with my good friend, Dr. Theo Marin. He's a consultant orthopedic surgeon in Caracas in Venezuela, and he has an interest in regenerative medicine. And you might have seen our first video about does PRP work in knee osteoarthritis. And today we want to speak about what are the risks of PRP injections. Hi, Theo.
Hi, Marcus. How are you doing? It is a pleasure to me joining you in this video podcast. And well, let's talk about the complications of PRP injections.
Yes. So obviously, when you do injections, you have to inform your patients what kind of risks there are. Can you tell me, if I come to you in the office and say, hey, I need a PRP injection for my knee osteoarthritis, what are the risks?
Well, it is a very good question. Actually, as it is an invasive procedure, as we are entering into an sterile environment, which is the joint, there is always a risk of having an infection, a septic arthritis, right? However, it seems that the risk is very, very, very low. As healthcare practitioners, we have this motto, primum non nocere, which means that first, do not harm. So it is very important to although the risk of infections are very low, to try to follow the best practices, like prepping the knee before doing the injection, maybe using some gloves, right? We conducted this interesting research on the open and closed PRP systems, because one of our concerns was what happens if we manipulate in an uncontrolled environment the PRP when preparing it, right? And according to our research, it seems that open systems do not pose a higher risk of infection, right? Which means that this can lower the cost of PRP preparation in some settings. And maybe it's more important taking care of other stuff rather than if it's a closed or an open system.
Yeah, so that's mainly about infection. And I've also read that if you use PRP or leukocyte-rich PRP, then this can actually reduce the risk of infection in certain procedures. How is it with knee injections?
Yeah, PRP has some interesting basic research, or even basic science research, I mean, animal experiments that state that PRP has some intrinsic antimicrobial effect. So this can also explain why the risk of infection is also very low when using PRP, okay? I think that there are no research on the risk of infection comparing different injections like hyaluronic acid, PRP, but in general, elective knee injections have a very low risk of infection, Marcus.
And with your research, come back to research, you've shown that it doesn't matter if you use an open or closed system. So possibly with using a open system, you could produce your own PRP and reduce the cost and still have the same quality. And if you watch our first video, then it's also, then you can also maybe direct your own dose.
Yes.
Coming back to are there any other risks of these PRP injections?
Well, the most reported one is probably the flare-ups, right? Having some reaction to the PRP with some knee swelling, some mild pain, okay? This is the most common one. And maybe some other related to the patient experience, right? Some patients may have a lower pain threshold or may feel a bit anxious during the procedure, and this can also maybe trigger some kind of faint or fear that we should deal with them in the best way possible.
And in your experience, how long do these flare-ups last, if they happen?
Look, in my private practice, I haven't experienced that many. Okay, I always tell the patients after the injection that they will feel some kind of discomfort for a couple of days, that it is not necessarily pain or but that they could feel something odd in their knee. Okay, I think that this might be related to the anticoagulant, as I have read in some gray literature. But the flare-ups are not as common as in these one dose hyaluronic acid injections, for example. I think that they are actually not that common when using PRP, at least in my practice.
And because of those PRPs, most people also advise not to restart their physiotherapy exercises for at least 5 or even 7 days. Is this also your practice, or?
Well, I have limited just for a couple of days. Okay, I think that exercise is also contributing to the improvement of this pathology, meaning knee osteoarthritis. So I think that in general terms, it shouldn't delay this additional treatment option.
Okay, so as a summary, we can say PRP injections are very safe. What can happen? A flare-up can happen. If this happens, then it's usually just for a few days, and simple measures like wait and see, maybe some paracetamol is enough. The risk of faint is there, which is with any injection, and that there's a risk of infection, which you have in any injection, but most likely because of what PRP is, it is less likely than with other injections.
That's right, Marcus. That's right. And I always advise my patients to do some cryotherapy after the injection in case they have some discomfort. Remember not using any kind of anti-inflammatories after the injection, because it would hamper the effect of the PRP injection. And I'm always performing my knee injections in supine position, because I think that the patient can feel better, can relax, and also in case of any faint, which is actually very uncommon, we don't have to worry about anything else.
And obviously, I have to say this, and maybe it's also advisable to do this injection under ultrasound guidance, as it has shown to actually make it more comfortable for the patient, because they have less pain. And obviously
100% sure.
And the injection is accurate. Okay, if we have mentioned every possible risk, then I thank you very much, and great research there for the future of our patients. Looks bright. Thank you, Theo.
Take care, Marcus. Nice to see you.